Hi, my name is Brandy Fannin, and before we get started, I want to introduce myself. So, I'm a pharmacist by training and a member of the UCB U.S. Neurology Medical Team. I have had the privilege of being a medical lead for Nasolam Midazolam nasal spray. I'm so excited to share a bit about Nasolam with you today, so thank you for the opportunity. Today, I'll be giving you an overview of Nasolam, which is a prescription midazolam nasal spray used for the treatment of seizure clusters in patients 12 years of age and older. We will talk a bit about seizure clusters, Nasolam administration, dosing, and how to use it, as well as patient resources that are available, and of course, important key safety information that you should know about Nasolam. And you can see a bit of that here in the introduction. I do want to call attention to our boxed warning, as Nasolam is a benzodiazepine medicine. It's important to know that taking benzodiazepines with opioid medicines, alcohol, or other central nervous system depressants can cause severe drowsiness, breathing problems, respiratory depression, coma, and death. So it's important to discuss these things with your physician. Additionally, there is a risk of abuse, misuse, and addiction with benzodiazepines, including Nasolam, which can lead to overdose and serious side effects, including coma and death. Benzodiazepines, including Nasolam, can cause physical dependence and withdrawal reactions, especially if you use Nasolam daily. So Nasolam is not intended for daily use. It is an as-needed medication. We will also talk through some of the other warnings and precautions with Nasolam, when not to use Nasolam, such as if you or your loved one have an eye problem called acute narrow-angle glaucoma, and the most common side effects. I also want to call your attention to the text that you'll see throughout the presentation at the bottom. For more information, including important safety information, the patient medication guide, instructions for use, and prescribing information, including the boxed warning, you can visit nasolam.com. Now here, we have just a brief disclaimer slide to inform you that, as I said, I am an employee of UCB. Additionally, there's a reminder here that everything we discuss today will be on label. UCB does not recommend the use of its products, including Nasolam, in any other way than that specified in our FDA-approved prescribing information. So with that, let's get started. Before we dig into the drug specifics, I do want to spend a few minutes grounding us in understanding seizure clusters and why it's urgent to treat them. As you may know, about 3.4 million people in the US live with epilepsy. And within that population, it's estimated that somewhere between 150 and 200,000 people experience seizure clusters. So, what exactly are seizure clusters? Seizure clusters are periods of increased seizure activity, which is having 2 or more seizures in a 24-hour period, with some recovery time between those seizures. Now, seizure clusters are different and distinct from your normal seizure pattern. And one of the things that I've certainly learned working in this area is that seizure clusters can be very different from one person to the next in terms of the number of seizures, the type of seizure, severity, or how long they last. It really is unique to each and every individual living with seizure clusters. And just in case you've heard them called something else, I've listed here some of the other names that they may be called. Seizure clusters is perhaps the most common term, but these other terms are sometimes used. So I want to just be sure we all recognize that no matter what word we use, we're talking about the same thing. Now, why are seizure clusters urgent to treat? Well, number one, we know that they are disruptive and not necessarily predictable, which can leave you feeling worried or downright helpless. And they can happen without warning. They can have serious health consequences, such as injury, hospitalization, and status epilepticus. So that's why it is so important to have a rescue medication on hand and to use it as soon as possible to treat seizure clusters. Now, with that being said, what is a rescue medication? As I said, a rescue medication is prescribed by your doctor to use as soon as possible during a seizure cluster emergency. It is used only when needed to treat a seizure cluster, and it is different from the daily medicines you or your loved one already take to manage epilepsy. And I say that because it's so important to keep taking your daily seizure medication exactly as directed by your doctor, and use your prescribed rescue medication when you need it to treat a seizure cluster. So I'll say it again. A rescue medication does not replace daily medication. So, how might a rescue medication be able to help? Well, there are a lot of factors to consider when talking about rescue treatment. First, you want something that works fast to stop a seizure cluster. And then also, you want to feel like yourself again. You also want to prevent additional seizures within the cluster. And of course, you want something that can be given by anyone, anywhere. So now, I'll give you some more specific information on Nasolam. You can see the picture of the nasal spray here on the screen. And as I said before, it is indicated for the treatment of seizure clusters in people 12 years of age and older. It contains midazolam, which is a benzodiazepine, which is a central nervous system depressant that has an anticonvulsant effect thought to occur by making the nerves in the brain less sensitive to stimulation. And as it is a benzodiazepine, of course, we have our boxed warning to remember here about taking benzodiazepines with opioid medicines, alcohol, or other central nervous system depressants, and the risks of abuse, misuse, addiction, and dependence. Nasolam is a nasal spray that treats seizure clusters in an outpatient setting. It can be administered by anyone. It does not have to be a healthcare professional. There's no priming or assembly required, and it may be given during or after a seizure within a cluster. Nasolam can be used wherever a seizure cluster occurs, at home, school, or work. It's also important to know that Nasolam is a controlled substance, so it's a Class 4 controlled substance. Now here, I want to point out that you don't have to wait to treat a seizure cluster with Nasolam. It can be given during or immediately after the first seizure if a cluster occurs. Even if the person is unconscious, there's no inhaling necessary. Now, of course, it is important that prior to using Nasolam, the person giving it should know how to identify seizure clusters and how to use this rescue treatment appropriately, which we will talk about in just a bit. Now, as a reminder, do not use Nasolam if you have acute narrow-angle glaucoma. And here I also want to call out the most common side effects reported with Nasolam. And these include sleepiness, headache, nasal discomfort, throat irritation, and runny nose. I want to introduce you to Nick, a real person living with seizure clusters, and his father and caregiver, Arden. All of the photos that you see within this presentation are actual seizure cluster patients that we worked with in order to ensure that we had true patient insight with the launch of Nasolam. And this just happens to be one of my favorite photos. Now, I won't read this quote from Arden directly to you, but I'll give you just a second here to read it and see if it resonates with you and your experiences. For me, people like Nick and his family remind me why we do the work that we do, and why it's so important to have rescue treatment options like Nasolam that may be able to stop the seizure cluster and help Nick get back to doing what he enjoys, like painting pottery, as you see here. So now we'll start to look at how Nasolam may help treat seizure clusters. Nasolam may help to stop seizure clusters within minutes and prevent further seizure activity for up to 6 hours. It may help get you back to feeling like yourself within hours, and keep more seizures from returning for 24 hours. In a randomized, double-blind, placebo-controlled trial, Nasolam helped the majority of patients to stop a seizure cluster fast and get back to what they were doing prior to that seizure cluster within 90 minutes. Now, of course, we always want to balance that with safety information. We've already touched on the most common side effects earlier, which you can see again here. But I also do want to point out that Nasolam may cause serious side effects as well, including impaired mental alertness, such as memory problems. So now we're going to look at some other things to know about Nasolam, like dosing and usage, and what to really expect with a Nasolam prescription. So as a pharmacist, this is one of my favorite slides because it is so practical. It really helps you know what to expect at the pharmacy. So first, you can see the picture of the box and the spray devices. Each box of Nasolam contains 2 single-use nasal spray devices, which should be stored at room temperature. We also have a reminder here that Nasolam does not replace your daily epilepsy medications. And you can see here that Nasolam is available through your regular local or mail order pharmacy, where you already get your daily seizure medications. So again, Nasolam is available through your regular pharmacy. But as a pharmacist, I can tell you it is a good idea to go ahead and call the pharmacy before you go to make sure they have it in stock. You may need to allow 24 to 48 hours for it to be delivered to your pharmacy. So now we'll look at the Nasolam dosing. The first dose is 1 5 milligram nasal spray, so 1 device, in 1 nostril when a seizure cluster occurs. If a second dose is needed and has been prescribed by your physician, a second dose can be used after 10 minutes in the opposite nostril. For that reason, it really is recommended to have 2 spray devices on hand. Now, do not use more than 2 doses to treat a single seizure cluster. And along those same lines, if the seizures do not stop after the nasal spray is used, get emergency medical help right away. Additionally, Nasolam should not be used for more than 1 seizure cluster episode every 3 days, and for no more than 5 seizure cluster episodes per month. It should be used exactly as prescribed by the physician. And if you use too much Nasolam, call your doctor or go to the ER right away. So now that you understand the dosing, let's look at exactly how to use the device itself, which is really important for you and your loved ones to know. Now, we have another quote here that, again, I won't read to you. I'll let you read it and see how it resonates with how you feel or with your experiences. But this is Eva in the yellow, and she lives with seizure clusters. And here, she mentions how reassuring it can be to have Nasolam with her and to have people around her, like her best friend Myrna in the photo, who know how to use it, because it is so important that the person giving it should know how to identify seizure clusters and how to use this rescue medication appropriately. So the good news is Nasolam is ready to use. There's no assembly required and can be given by anyone whenever seizure clusters occur. Here we have an overview of the steps to using the actual device. To see the complete steps on how to use Nasolam, please take a look at the full instructions for use available at nasolam.com, which you would also receive with your prescription. And you can see that you open the blister pack, you hold the device with your thumb on the plunger, but not pressing it yet, and then place the tip of the nozzle into 1 nostril until your fingers are against the bottom of the nose. Then press the plunger firmly. You'll feel it go in, and the plunger won't come back out after it's been used. Remember, it is only a single-use device. And then once you're done, throw away the blister pack and the device. Now, once Nasolam has been used, it's important to know not to drive, operate machinery, or do other activities that require mental alertness until you know how Nasolam affects you. Also, do not drink alcohol or take opioid medicines or other medicines that make you sleepy or dizzy while taking Nasolam until you talk to your doctor. If you would like to see a video of how to use Nasolam, or would like just a reminder after this presentation, we do have one available at nasalrescuetreatment.com. Now, before we talk about some of the other resources we have, I do want to take just a few minutes to discuss the important safety information that you should know about Nasolam. Some of it we've already discussed, so I won't read it verbatim, but please take a look at this slide as I talk. As a reminder, the important safety information is also available on our website at nasolam.com. We've already discussed the boxed warning about use with opioid medication and the risks of abuse, misuse, addiction, and dependence. Nasolam may cause serious breathing problems and excessive sedation, so get emergency medical help right away if this occurs. Nasolam can also make you sleepy or dizzy and can slow your thinking or motor skills, so be sure you know how Nasolam affects you before doing activities that may be affected by these side effects. And do not drink alcohol or take opioid medicines or other medicines that make you sleepy or dizzy while taking Nasolam until you talk to your doctor. Like other anti-epileptic drugs, Nasolam does come with a warning around suicidal thoughts or actions. It's important to be mindful of this and contact your doctor if any new, worse, or worrying symptoms occur. Nasolam is a controlled substance. It's a Schedule IV because it is a benzodiazepine, and it can be abused or lead to dependence. So tell your healthcare provider if you have abused or been dependent on alcohol, prescription drugs, or street drugs. Now, it is not known if Nasolam is safe and effective in children under the age of 12. So it is only approved for use in patients 12 years and older. Do not use if you're allergic to midazolam or have acute narrow-angle glaucoma. And of course, it's important to tell your doctor about any health conditions or medicines you or your loved one take prior to using Nasolam. And here, I'll also review the key points we've already touched on about dosing. So Nasolam is for use in the nose only, and it's important to use it exactly as prescribed. To highlight, you use one device in one nostril to treat once you've identified a seizure cluster. If the cluster is continuing after 10 minutes, you may use a second dose in the opposite nostril if prescribed by your doctor. Do not use more than 2 doses to treat a seizure cluster. And if seizures don't stop, get emergency medical attention. To further review, do not use Nasolam more than every 3 days and no more than 5 times per month. This is an as-needed medication, so it is not intended to be used daily, only as needed. And just one last reminder here. The most common side effects are sleepiness, headache, runny nose, nasal discomfort, and throat irritation. We encourage everyone to please talk with a healthcare provider if you have any questions or concerns about Nasolam. Your doctor is absolutely the expert on you and your needs. So, as we wrap up, I want to be sure that you know what tools and resources we have available on the website at nasalrescuetreatment.com. We have a patient brochure with information about seizure clusters and Nasolam. We also have a Nasolam patient savings card, where you can check your eligibility and sign up for savings on your prescription. And there are 3 ways to do this actually. So, one, there's the website, again, nasalrescuetreatment.com. There's also a text to save option. So, if you've got your mobile device handy, you can text Join NAS to 50566, or you can call the phone number listed on the screen. And lastly, we also have a very handy training kit, which includes information and a training device to help you and your loved ones practice how to use the nasal spray. The training device looks and feels like an actual device, but it doesn't contain any active medication, and it can be reset and practiced with again and again. Now, I've personally found it very helpful to get a feel for the device and how the plunger feels going in. I think it's a really key resource for getting comfortable with the device itself to help you and those around you be prepared to treat a seizure cluster. So, as I've mentioned, lots of good stuff available on the website at nasalrescuetreatment.com. Additionally, we also have a great resource called Ucb Cares, which is a team of nurses, pharmacists, and customer service professionals who you can ask questions to about UCB products, including Nasolam. They can also help you report side effects or product quality concerns, get clinical trial information, and find information on affording your UCB medication. Their phone number and website are listed here as well. So with that, I want to thank you so much for taking the time to learn more about seizure clusters and how Nasolam may help. Thank you.